Hello and welcome everyone. Today is a special day for me. Before going through the guest, I want to say all of you that she is a very special person in my life. I can say she has given me second birth when I was in a stage where I thought that I maybe will see this world again or not. That stage, she helped me out, and she is none other than my gynec oncologist, my surgeon, who actually treated me during my cancer stage. So let's welcome Dr. Usasri Das. And I can say all those I know about her, but still I want to know more about her. So can you please introduce yourself, ma'am?
Rashmi Das, thank you very much, Shravani, for having me. I'm really honored and I feel special that you thought me important enough in your life to have me in your podcast. So thank you very much. I'm Dr. Ushashri Das for all your audience. I work as a consultant gynec cancer surgeon in Bakshi Sri Sankara Cancer Center. I have done my MBBS from SCB Medical College, Cuttack, then MS in OBGY, Obstetric and Gynecology from Grant Medical College, Mumbai, and then my super specialization in gynecological oncology from Tata Memorial Center, Mumbai.
Hmm. Okay. Yes, ma'am. So I think this is a very difficult field, gynec-oncologist, to be a gynec-oncologist. You must be having very busy schedule and doing so many things. So can you say me what inspired you to choose the specific field of this gynec-oncologist?
So when I was doing my MBBS, I was really inspired by the surgery part of it, the anatomy part of it, because it
Okay.
intrigued me. The human anatomy, it intrigued me. So after MBBS, for a girl, OBGY, obstetric and gynecology, was a natural transition rather than general surgery.
Hmm.
And after OBGY, again, gynec-oncology was the natural transition because the surgery and the science of it, everything was more intricate and more developed compared to other branches. So that is why I opted for gynec-oncology.
Yeah. So, ma'am, as you treated me, can you tell me what are the current trends or most common types of cancer now among women?
In Indian women, specifically, breast cancer is the most common, followed by cervical cancer, which is the cancer of mouth of uterus, and then ovarian cancer. But now, because of urbanization, uterine cancer also is coming up as a more common type of cancer.
Okay.
So
So,
most common are breast, cervix, and ovary, followed by head and neck and colorectal.
so can you tell me, are there any early signs or symbols that women should never ignore?
Most of the cancers, they will have some early signs and symptoms that we most often ignore. Most commonly, the women only will ignore, saying that maybe these are only perimenopausal symptoms or common hormonal changes because of menstruation. The cardinal symptoms that we must never ignore is lump,
Hmm.
feeling a lump in anywhere of the body, specifically breast and abdomen. If you're feeling any lump, then most probably it is something wrong in the body. We need to go to a doctor and get ourselves checked. And then postcoital bleeding, postmenopausal bleeding, these symptoms should never be ignored. Even if there is one spot of bleeding after sexual intercourse or even one spot of bleeding after menopause, then we
Hmm.
need to go to a doctor and get immediately investigated. And then there are very soft signs and symptoms like we are not interested in eating anymore. Previously, we used to eat maybe 1 cup of rice. Now we are eating only half cup of rice. Or there is
Okay.
unintentional weight loss or
Okay.
the abdominal distension, there is unexplained constipation, frequency of micturition, vague pain abdomen, some disturbance in menstruation, continuous foul smelling discharge. All these symptoms are very soft symptoms, but if they are
Hmm.
persistent for maybe 15-20 days, then they need to be investigated.
Hmm. Actually, one wonderful tip you have given here. that we need to diagnose ourselves if I am having any kind of discomfort or having any kind of sign like this. Because I have also delayed for so many times, thinking that it might be my perimenopausal stage, premenopausal stage or perimenopausal. I don't know about.
Perimenopausal. Perimenopausal, yeah.
But
That we do.
I was
That we do.
thinking that I am over 40 years now, and while I was going through internet, I was surfing that I am having this kind of symptom. It was showing me that after 40, these are the symptoms: belly fat gets deposited, or it's premenopausal symptoms like that. So I was trying to cure myself with jeera pani, methi pani, and all those things. So we should not never, we should actually never ignore all these kind of symptom, I can say, and that is very important for early diagnosis. Otherwise, the same thing gets complicated. Yes, ma'am. Thank you for letting us know about that. So, can you tell me what lifestyle habits or precautions can women adapt to reduce their cancer risk?
Yes, the most common and the easiest thing that we can do for ourselves is maintaining a healthy lifestyle, like active lifestyle. If I'm exercising every day for at least 30 to 45 minutes, if I'm eating healthy, like green vegetables, no junk food, no red meat, no fried food, then my chances of having acquiring a cancer is minimized. And then above that, if I'm minimizing my stress also with meditation
Oh,
and having a good social circle to let my stress out, that also will help. And apart from that, if I'm vaccinated regularly, getting health checkups regularly, that also helps a lot. So we have very specific strategies to reduce our risk of any type of cancer, though we cannot nullify it. We cannot say that if I do these things, then I will never have cancer, but we can
hmm.
reduce it to maybe 60-70%.
Okay. So, ma'am, actually, you here stressed on stress as a part of our life, and also to maintain so many things in our life, so that not to eating junk and to maintain our exercise level. So, can you tell me, in your experience, how does stress or emotional trauma play a role in cancer?
There have been numerous studies now linking
Okay.
chronic stress. Not one time like I had a fight with my friend and then I get cancer, not like that. But
Hmm.
if I am having chronic stress year after
Okay.
year, then my
Okay.
hormonal balance also gets disturbed and
Oh.
my immunity also gets disturbed. And both of
Okay.
them we know will help in like attracting, like honey acts like to bees. It will attract all kinds of ill health that also include cancer. If I'm chronically immunosuppressed, if my hormone balance is totally imbalanced throughout years, then
Hmm.
I'll attract more type of illness, including cancer. And if I
Okay.
acquire any illness, then my immunity to fight against them also is reduced.
So, as per you, that mind body connection actually exists, right?
They do proven multiple times.
Oh, great, great. So, actually, I have also found that same thing during my disease, because I was thinking there is no connection from my parents, or nobody has suffered from my family. I have active lifestyle, then why I am suffering like this? So, I also found that might be stress is the one
Chronic stress
reason.
definitely will aggravate any illness, including cancer, and the power to fight against that illness also is reduced with chronic stress.
Okay. So, whoever is watching our podcast today, I must suggest that if you are going through any kind of stress in your life, you must check how to reduce the stress, right, ma'am?
Yes.
You should not go through that prolonged stress. And also, you need to take care of your physical health by going through exercises, yoga, or anything like that. And also take care of your fooding pattern also. And then, ma'am, tell me, how do you see mental health affecting a woman's recovery after diagnosis? What happens?
Immensely, immensely. Like if I give your example, Shravani, then
Yeah.
I remember the day you were operated. You were obviously not conscious, so that we'll exclude that day. But the next day you were hearing some affirmation, you kept some affirmation notebook or book besides you. I have
Yes.
seen only two patients. First is you, and then another 20-year-old girl who kept on listening to those affirmations that I'll get better, I'll get better, I'll get better. And your recovery was really fast and really wonderful. So, that emotional resilience is very necessary to recover from anything. Moreover, this life-threatening illness called cancer, we really need to be emotionally resilient. Emotionally resilient people will be able to accept that, okay, I have this issue now, and then they'll accept that, okay, I need to go through these investigations. And third step, okay, now I'm diagnosed with this cancer, with this stage, I have this issue now, I have to go through this treatment also. That acceptance level is also very important, because we have seen people who are not very mentally strong, like they'll be very sad easily, and or they'll be very anxious easily because now I have cancer, my life is finished now. That anxiety part is uh, overburdening on them, like they're overcome with this anxiety and sadness, then their acceptance level is very low. They'll resist the investigation part, they'll resist the treatment part, they'll have more amount of complications, side effect because of their chemotherapy, radiotherapy, whatever. And then sometimes even to the extent that they are not able to complete their treatment, chemotherapy or radiotherapy, because of this side effects. So being emotionally strong, being emotionally resilient is very important to go through cancer treatment and recover from it.
Yes, ma'am. Very true. It is, you have said. Actually, the diagnosis system is so rigorous that at that time I was thinking that I will die in this diagnosis only. What to say about surgery and other things and chemo. So the effects are really adverse, but one can only handle through her mental resilience. Yes, that is the only solution, to accept it. And it takes time, but still you need to accept if you are facing something.
And
So yes,
sometimes
true.
what happens, because they're very restless, they will say that no, 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 you don't have to do all these 3, 4 investigations. Just do one investigation and then get to the treatment part. Then if you're
Hmm.
not investigating properly, the treatment also won't be proper. So that
Yes,
also is there. So over enthusiastic that no, 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 we'll go jump to the treatment part, or no, 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 I won't accept this in diagnosis. I won't go through any of this, and then sit at home and the disease progresses. Both the extremes are not helpful for the patient.
correct. Very true. So, ma'am, tell me, what emotional and psychological support systems should a woman build during and after cancer treatment?
So, uh, we are
Like,
from Odisha.
I can say yes, yes.
We are from Odisha. We know that we normally, maybe some people will disagree, but we normally don't get that much support at our family, in our families. So, though family help, friends help, their support is vital, really vital, because they have to support us. Otherwise, we won't be able to go through any adversity. But I urge patients that whether you have support from your family or not, whether your husband or spouse is supportive or not, whether you have a friend circle or not, you have to be strong. You have to be very motivated to go through all this and then recover from all this.
Yes, ma'am. I can say while I was going through that chemo in that hospital also, I have seen many patients coming towards me, how you are keeping your positivity and why we are going through all these symptoms and we cannot tolerate all those things. So at that time, I just say them, do you want to live? If there is a reason that you want to live further, then you must tolerate all these things. If you do not have any urge to live further, then everything will impact like this only.
Mm, mm.
So that is the
It's
main
very
thing,
important.
that urge to live uh, in any situation.
Reason to live. At the end of all this, what do I live for?
Yes, yes, correct. You should know why I want to live.
Mm.
So that should be clear in our mind. So, ma'am, tell me, what role does family and society play in supporting a woman through who is going through cancer? What
Like
needs
I
to
said,
change?
the change that I really discuss with all the relatives that come to my OPD saying that the patients they don't know the diagnosis and we should not disclose them to them. I
Hmm.
really request them to discuss everything. Sit with them, discuss with
Hmm.
them that this is the diagnosis, this is the further course of investigation and then treatment, and then gradually disclose, maybe not in the outset only, but gradually discuss the prognosis also. Like some cancers are obviously not in a good shape because they have delayed the diagnosis that much. But whatever the condition, if we discuss openly, then
Hmm.
the burden on the patient is reduced significantly. Otherwise, she is in dark. She is in complete fear that she's scared that I don't know what is happening to me. I don't know what is the diagnosis. I don't know what is the
Hmm.
stage. Maybe I'll die in 15 days. Maybe I'll live for 6 months. I don't know anything. But that collusion, not disclosing the diagnosis and the prognosis to the patient who is suffering herself, is, I think, not very nice on the patient part. She should know. She has a right to know. And
Yeah,
then
correct.
I see specifically old ladies who are terminally ill. The relatives they don't support their symptomatic care. Like a patient, if
Hmm.
is suffering, if she is having
Yeah.
pain, then a relative needs to take her to a hospital where her pain or bleeding or whatever symptoms she has, that needs to be relieved. But I don't see,
Hmm.
because the prognosis is bad. Okay, let her die peacefully at home. But how can she die peacefully at home if she is having pain? So that
Yeah.
terminally ill, specifically old lady, widowed lady,
Hmm. Hmm.
that
Hmm.
part is missing. That support is missing.
Yeah, it's actually very true, I can say, मैम। मैंने देखा है और एक पेशेंट जिसका वो जो भी रिलेटिव्स आ रहे थे उनके साथ, उनको बहुत इरिटेशन हो रहा था कि कितना
Hmm.
टाइम जा रहा है।
Hmm.
और जो
That should not
पेशेंट थी,
happen.
शी वाज फीलिंग गिल्टी कि देखो
Hmm.
मेरे वजह से सबका
Hmm.
लाइफ में इतना डिस्टर्बेंस हो रहा है।
Hmm. Hmm.
सो एक्चुअली वी नीड टू अंडरस्टैंड दैट पेशेंट इज अंडरगोइंग already in pain. She is already
Pain.
in pain, and still, if you are showing your irritation or anger, then definitely that also impacts the patient.
Hmm.
So in that case, actually, the patient don't want to live further because they think that for me, my family is getting disturbed.
Hmm.
It's better to
Also,
die.
yes. Also, most of the time, the rural area, village area women,
Hmm.
especially older ladies and who are widowed, the diagnosis in them is delayed because of this thought only. Now I'm having postmenopausal bleeding. I might have
Huh.
cancer, but I
Huh.
won't disclose because if I disclose, they'll take me to a hospital and all their life will be destroyed
Disturbed.
or
Yeah.
disturbed. So
Hmm.
that thought only will delay the diagnosis further. What could have diagnosed in stage 1 goes on to stage 3.
एक्चुअली ये एक ऐसा स्टेज है जहाँ पे पेशेंट को भी थोड़ा सा चाहिए होता है बैकअप सपोर्ट,
Hmm.
और
They need
रिलेटिव्स
that.
भी
हाँ.
थोड़ा सा समझदारी दिखाना पड़ता है कि
Hmm.
अगर कोई डिफिकल्टी सिचुएशन में, यही तो टाइम है कि हम
Hmm.
फैमिली के साथ कब
Hmm.
खड़े रहेंगे। तो
Hmm.
दिस इज
Hmm.
द ओनली टाइम।
Hmm.
So, ma'am, tell me, what are the some common myths or misunderstanding about cancer among women that you would like to boost?
First is cancer. If I'm diagnosed with cancer, my life is over. This is a death sentence, maybe 1 or 2 years, and then my life is over. That is
Yes, yes.
the biggest myth. If I'm diagnosing a cervical cancer or ovarian cancer in stage 1, the 5-year overall survival is 90%. Meaning
Okay.
maybe 90% of the women will go on to survive for at least 5 years and then maybe go on to live for 10, 20 years if I'm diagnosing early and if I'm treating them properly. Number
Mm-hmm.
one, that. And number two, if I'm diagnosed with cancer, then my quality of life is ruined. I'm totally, how do I say? Uh,
Correct, correct. I can relate all those things because I have gone through those experience. I was thinking that I am going to die. Every time I will see my children's face, uh,
uh,
auto automatic tears will roll down. and yeah, I can
I'm
understand.
not an interesting person anymore because some of my body organs are removed, so I'm not very interesting anymore. And then for young people, my fertility is gone. If I'm diagnosed with cancer, my fertility is gone. I won't be able to conceive anymore. So these three are the main myths what women carry with them. But I'll again give your example that you are leading a very fruitful life after being diagnosed with higher stage cancer and a risky cancer, and then you are being very fruitful. You are not just sitting in a corner and crying now that my life is ruined. You are a very interesting person and doing your bit in the world more than most of people who don't have cancer. So it is not a death sentence. We don't stop becoming an interesting person after we are being treated for cancer. We some cancers we can treat accordingly so that we can maintain our capacity to conceive further after therapy. So all these advances in science have been developed that our life is not totally finished after cancer diagnosis.
डेफिनेटली, जैसे आपने कहा, एक्चुअली लाइफ इज नॉट फिनिश्ड आफ्टर कैंसर डायग्नोसिस, और टेक्नोलॉजी में बहुत ज्यादा एडवांसमेंट भी हो रहा है। वो पहले जमाने की बात थी, जब कैंसर में कोई डायग्नोसिस हो जाता था तो एंड विल बी डेथ। अभी वैसा नहीं है, तो डेफिनेटली वी शुड गो दैट। और आपने जो बताया कि लाइफ एंड नहीं होती है, और ऐसा ही स्टेज हमें बताता है कि हाउ मच वी शुड वैल्यू आवर टाइम। That realization I got during that time only. Otherwise I was always in a people pleasing mode कि सबको खुश रखना है और मुझे क्या चाहिए, क्या करना है, वो मुझे ध्यान ही नहीं रहता था। Wonderful. So ma'am, tell me, as a woman in a high pressure, emotionally demanding profession, how do you manage your own mental health and work-life balance?
So it is like any other profession, really. If I love my profession, then it doesn't actually take me separate time to energize me. I feel energized in my work only, so that is not a difficult issue for me. But having said that, I do exercise regularly. I do meditate regularly. I value my family and I let them know that I value you. So all these things go hand in hand.
Wonderful. What was your most memorable patient journey that touched your heart?
I still feel like crying when I remember that lady during my training period in Tata Memorial Center, Mumbai. My first night duty, one young lady, 30-year-old young lady, she came to me with a maybe 6-month or 1-year-old child, carrying her child on her lap. For aside, she had advanced ovarian cancer with fluid, big belly, lots of fluid accumulated in her abdomen. She came to me for draining that fluid 10 o'clock at night, because in the morning, because she doesn't have any social support, in the morning she has to work some daily laborer, and at night only she has time. So with her kid, she'll come to casualty for tapping her fluid at night. And for 3-4 consecutive times, I drained her fluid, and then she started her chemotherapy. After chemotherapy, obviously she recovered, but that image still I carry with me, that I can be that strong. I am actually inspired by her, that having advanced ovarian cancer, this big belly filled with fluid, carrying a child 6 months or 1 year, because I have to live for that child. I'll work throughout the day, and at night I'll go to casual to drain my fluid and get treated. So that was really inspiring.
Really, this story actually inspired me also. A very wonderful story of how hard one can struggle to get a life for a child. So, from your experience, what helps women stay mentally strong while navigating surgery, chemo, and recovery?
That I think is a very inner strength we need to develop. Some people have it innately, some like us, you and me, we have to work on them. Like we can get someone's help like you, or meditate, or read Bhagavad Gita or pray, do whatever it takes, but we need to develop that inner strength to navigate all these. May it be just cancer treatment or any other struggle. To navigate any
Yeah,
struggle in life, we have to have that inner strength.
definitely. It is a great thing. Actually, inner strength is the core to handle every situation in our life.
Any situation.
Yes, ma'am. For women who are listening or are either battling cancer or supporting someone who is going through that stage, what is your core message to them?
My first message is any abnormal symptom, we need to pay attention to our bodies because we are our first best friend. Then only we have other best friends. We need to act as if we are our own best friends. If I'm feeling something abnormal, then I need to take care of myself and get myself checked. Number one. Then getting properly investigated and getting adequately treated from a proper hospital or a doctor, that will give me the maximum benefit, maximum chances of recovery. So I need to investigate where I can get investigated, where can I get my best treatment, whatever facilities I have, whatever budget or finances I have, I need to investigate that properly and get properly treated in the first go. Because if the first treatment, like first surgery or first chemotherapy is inadequate, it is very difficult to reverse it. The first treatment has to be the best treatment. Number one. Number two is very important, open discussion. If a person is caring for a person who has cancer, who is taking treatment for cancer, we need to have a very open discussion with them that this is the condition, this is the treatment, and this might be the prognosis. And most probably you will recover. But if you are not recovering, whatever the condition, we are there to support you so that the burden on the patient is reduced, so that she is relieved that, okay, they are with me, my family persons are with me. So these two, that we need to be our own best friends to get the best treatment for ourselves. And if I'm supporting a person, a family member who is suffering from cancer, then I need to be very open with them.
Correct. Wonderful, actually. So early diagnosis is a must. If you are having any kind of discomfort, then we should diagnose it at the earliest possible. और इसमें मैं और एक बात कहूंगी, मेरी एक डायग्नोसिस में डॉक्टर जो मुझे बोले थे कि जो नखरा दिखाती हैं कि कुछ भी हो गया, चलो डायग्नोसिस कर लेते हैं, वो अच्छे होते हैं हम डॉक्टर्स के लिए कि हम उनको अर्ली ट्रीटमेंट दे पाएंगे। और जो सहन कर जाते हैं, मोस्टली वी वुमेन डू दैट, कि आज बच्चे का कुछ काम है, आज घर पे कुछ काम है, आज घर पे गेस्ट है, ऐसे करते करते डिले हो जाता है। और डिले करते करते खुद के ही शरीर को हम नुकसान पहुंचाते हैं और इतना कॉम्प्लिकेटेड हो जाता है कि तब हमें डर लगता है कि मैं जिंदा रहूंगी या मर जाऊंगी, क्या होगा। तो ये एक बात है। और नेक्स्ट, आपने जैसे कहा कि हमें ओपन डिस्कशन करना है। अगर हम किसी पेशेंट को हेल्प कर रहे हैं तो उसको बताएं कि वी आर हियर फॉर यू, और कुछ भी होता है प्रॉब्लम, वी आर हियर टू सपोर्ट यू। वंडरफुल मैम। सो इफ यू हैव टू गिव वन गोल्डन रूल फॉर वुमेन्स हेल्थ एंड वेलबींग, व्हाट वुड इट बी?
Make yourself important.
Okay.
Listen to your body and make yourself important. Priority rather, not important, priority.
Okay. Make yourself important.
Mm.
You are your priority, right? So, ma'am, what is your go-to stress booster?
Go to stress booster. Meditation, maybe.
Favorite mantra?
Favorite mantra. I don't have any actually.
Okay. And what one thing you will suggest to every woman, irrespective of cancer, having cancer or not, or anyone?
Early diagnosis, early diagnosis. Whatever symptom you have, go to a doctor and get yourself checked.
ओके, वंडरफुल। सो अगर कोई भी ओडिशा वाले मुझे सुन रहे हैं, देन आई विल बी गिविंग मैम्स एड्रेस, एवरीथिंग इन दिस डिस्क्रिप्शन। आप उनसे डायरेक्टली जाके कनेक्ट कर सकते हैं। और मेरे तरफ से 100% आई एम सेटिस्फाइड एंड आई थिंक मैम इज द बेस्ट डॉक्टर और जब भी हम कुछ भी ऐसे स्टेज में जाते हैं, हमें एक अच्छा डॉक्टर जिसके साथ हमारा मेंटली हमें भरोसा होता हो, वो बहुत इम्पोर्टेंट है, क्योंकि वो हमें सपोर्ट देते हैं, वो हमें गाइडेंस देते हैं। तो आई एम 100% फुल्ली सेटिस्फाइड विथ मैम, एंड आई एम ऑलवेज ओब्लाइज टू मैम कि कैसे मुझे जो क्रिटिकल स्टेज था मेरा, उसी टाइम पे मैम ने मुझे इतना सपोर्ट दिया। तो आई विल बी गिविंग ऑल हर डिटेल्स इन माय डिस्क्रिप्शन। और अगर किसी को इनर स्ट्रेंथ चाहिए तो मैं हूं ना।
Uh,
ओके।
I'll say two lines about you, Shravani. I have never seen a patient so happy, so jovial, so strong like you. I really admire you that during your cancer chemotherapy also you were planning to do this. I have these many plans for myself. I need to work on myself. During receiving chemotherapy, you were tired, you were having pain, your hair were losing, but still you were planning, okay, after recovery, I'll do these things. So I was always in awe of you. Like women can be this strong, not for the children, for yourself. You wanted to do that for yourself. So it
Yes,
was
ma'am.
really inspiring.
So actually, there is a fear inside me, if I'll be leaving or if I'll be dying. So I wanted to leave something for my children. That's why I wrote my book also. कि
Hmm.
मेरा एक्सपीरियंस कुछ तो मेरे बच्चों के लिए हो, जिसमें कोई थर्ड पार्टी आके उनको कुछ सुनाए, उससे ज्यादा वो खुद ही मेरी बात खुद ही मेरे मुंह से सुन लें। तो एक्चुअली दैट वाज इंस्पायरिंग फॉर मी कि मैं कुछ तो छोड़ के जाऊं बच्चों के लिए। तो ऐसा है। ओके मैम।
Very rarely anyone does that. During chemotherapy, they write a book.
Actually that was a very stressful moment, and I can say I released all my stress through writing, through writing only. Yeah.
Kudos to you.
थैंक यू मैम, थैंक यू सो मच। और जो भी
Thank
देख
you.
रहे हैं, अगर आपके जानकारी में कोई भी है ऐसे सफर कर रहे हैं और आपको लग रहा है कि उनको कोई भी तरह का काउंसलिंग चाहिए मेडिकल के हिसाब से, तो आप मैम से कनेक्ट कर सकते हैं, ऑनलाइन एंड ऑफलाइन। ऑनलाइन भी आप काउंसलिंग कुछ करते हो मैम? नो,
Offline.
ओनली
Online,
ऑफलाइन।
they can
ओके,
connect me through WhatsApp, then I can advise them.
ओके, ओके। कैन आई गिव योर नंबर इन द डिस्क्रिप्शन?
Yes, you can.
Okay. So I'll give ma'am's number. If you want any kind of counseling, then you can directly connect to ma'am. Ma'am is so very experienced, and she can handle every problem of a ladies, and she has that capacity to support and give you that strength. So ma'am, I can only
Thank you
thank
very
you from
much.
your busy schedule. You took your time and gave your precious time to all of us to make us aware about cancer and how to get that inner strength during that time. So thank you so much, ma'am. Thank you.
Bye. Bye,
Bye
Shravani.
bye.